So, in our last section, we talked about some of the financial repercussions of making stupid decisions about your healthcare education. I kind of belabored the point a little bit more than I needed to, but I want to show you something. You see, you shouldn't use camp stoves indoors, but this baby throughout my entire anesthesia education served as my fuel, my heat, my light source, and obviously for cooking. Now, it's a very, very safe device. I mean, people have been using propane since, I don't know, was it the Chinese 1,000 years ago? Maybe that's black powder I'm thinking of. Come on, why is this thing lighting? And birthday candles, those are... Oh, this does remind me though. Carbon monoxide has been shown to have a variety of vague and unsettling effects. Obviously, death can be one. Death can be one of those effects. And really, for you anesthesia people out there, if you're using desflurane, make sure that every so often when you have your flows at 0.3 liters, that you turn up your flows a little bit when using desflurane so that your patient breathes oxygen instead of carbon monoxide. Now, where was I? Oh yeah, I didn't really live in a hotel room with just a sweet little camp stove as my only source of cooking and heat during anesthesia school, but you get the point. Sometimes you can go a little bit overboard. For instance, my younger brother decided to get an apartment near his workplace, and it was really cheap, great location as far as the distance from his workplace. But after a while, he started saying to himself, "Is that black mold I smell? Or are my neighbors reopening up their meth lab?" And when you start asking yourself those questions, you must also ask yourself the question, do I really need to live here? So, on to our next topic. What was that? I think it was a camp stove falling inside the cooler where I hid it in case the cleaning lady comes into this hotel, and they might have a policy against open flame in hotel rooms. Not really sure, to be honest. Rather not find out. So, on to another topic. A similar topic, and that is of weirdness. You know, anesthesia, medical field, nursing, PA, all those fields do tend to attract weird people. Not weird as in flamboyant for the most part, often weird as in tiny little super creepy idiosyncrasies. And how do you deal with that? Well, the first thing I need to tell you is to try to avoid those awkward conversations. Let's say you have a clinical preceptor who carries around boiled eggs. A triad of frozen boiled eggs. Now you're probably tempted to ask him, why do you have this strange configuration? Why do you handle it as you thoughtfully look at patients and think about their diagnoses and how to best improve their health? But really you probably shouldn't. You probably should bring nothing up. You probably shouldn't even eat eggs around them. If you bring a carton of eggs to clinicals, just don't even mention the similarities between your eggs and their eggs. Just don't go there. You don't want to know what those eggs are about. You don't want to know anything about that situation. Just keep your mouth shut. Never bring up eggs. You understand? My nose itches. I'd pick it, but I think the camera's still on. So I'm just gonna pretend to blow my nose, but I actually relieve the scratch at the same time. Oh yeah. That's a spot right there. You don't even have any suspicion what I'm doing, other than my nose, which is probably red at this point. So, as I said, you're also probably weird if you're interested in any of my work. And realize that not everyone is interesting. You've all seen Scrubs episodes. That's a great show, one of my favorite shows of all time. In fact, I reference it way too often for being the creative person I pretend to be. But sometimes you'll find that people in healthcare, the ones that aren't weird, or at least secretly weird, are also boring. Now the boring ones are even harder to deal with than the weird ones, because they'll just want to talk to you about functional residual capacity at all times, or perhaps respiratory response curves, drug dosing curves, just terrible, terrible things that no one should ever talk about outside the confines of a classroom. I mean, I know all that stuff, and I'll talk about it, like I said, in a classroom to try to keep myself awake. But once you exit that classroom, we don't really talk about those things. It's not proper, not kosher, whatever you want to say. So, how do you deal with boring people? Well, you may need to act boring yourself, Because if you start telling them personal stories about yourself, trying to keep the conversation going, you may reveal a little bit more than you really need to. Don't forget, the OR and all healthcare settings in general are a place where stories travel faster than anything. Even faster than E. coli infections, the flu, hepatitis. I can go on, but I think you understand my point. A good story, some good gossip, even a good confrontation will basically make the evening news in the hospital. And so the best way as a student and as a new practitioner, well really as anyone, is to avoid being a topic of conversation. Nothing good ever comes out of it. You don't want to be the one that confronted the nurse about that medicine order, because really nothing good comes out of it. No one's going to be like, oh, I respect them. They got in an argument about Rocephin. Rocephin's such a cool drug, I will follow blindly anyone who argues with anyone about that wonderful antibiotic. Do you understand my point? It does you no good to get into a confrontation. You should try to avoid them as much as possible. Because you see, you're paid a salary, and that is your prestige. The ability to buy things. The ability to have heat, electricity, you know, those things that here in the first world we think are fairly important to life. Your prestige doesn't really come in the titles after your name. That's just what gets you a salary. Now some of you, probably the ones of you who have pins on your badge and a hat on your head, are probably offended by me saying that your nursing job, your anesthesia job, whatever, is that. It's a job that pays bills. But at the end of the day, if you have a practical approach to your job, that you're just there to do your job, take care of patients, make sure everyone lives, make everyone happy, I think you'll get along better than if you have a righteous need to defend your profession against the onslaught of, I don't know, the medical profession. Those creepy lab workers that only come around at 3 a.m., that pharmacy tech you can't stand. Who knew that that dinky little dorm refrigerator had such freezing power? I mean, what am I going to do with these eggs? Ah! Oops. That's okay, I just put ice shards all over the floor. But Melanie told me not to eat these frozen creepy eggs anyways. What do you expect from a continental breakfast? Maybe I can juggle them. That would be entertaining. My juggling skills are limited to 2 eggs. This is why I was much better at book smarts than at clinical kinesthetic skills. You can imagine someone who can't juggle 2 eggs. Probably took me a while to learn how to properly place an epidural. I mean, don't get me wrong, I'm awesome, but still. Where are those eggs? I mean, we're still in this hotel for another day or two. They should start smelling, right? That's how I'll be able to tell where the eggs are. That seems like an appropriate way to find things. Once it starts emitting an odor, think of it as like a pheromone so that you can focus your search. Yeah, that's reasonable. Oh wait, there's one. Okay, 2 to go. The next thing I wanted to talk about as I'm searching for these frozen boiled eggs, hard-boiled eggs. Have I been calling them boiled eggs? I believe the term is hard-boiled. But maybe they're soft-boiled because you can't really tell if they're soft or hard-boiled until you crack one open, right? And I do mean crack since they're currently frozen. Anyways, what was I talking about? I remember. So how do you put up with stupid ideas? Especially if those stupid ideas are put forth by your superiors. Now in the ICU, I earned the nickname Tricky Nick because there was a nurse who had many more years of experience than I did, but I didn't like any of her ideas on how to take care of patients. So she'd tell me to do something which was none of her business because it was my patient, and I didn't really want to tell her off, but I certainly wasn't going to do what she wanted me to. So I developed a long-handed way of using very large words, none of which I'm using right now in this video, to really tell her, no, I'm not going to do that, but in a polite, sophisticated, I'm not sure what he really told me, so I'm going to leave him alone type of way. And you need to do something similar. Whether someone is your superior or your coworker, let's say in anesthesia, an anesthesiologist will tell me something that I may disagree with. Well, as long as it isn't going to harm the patient terribly, that's not a big deal. And we don't really need to even have that discussion because it's his opinion or her opinion. I have my own opinion. If it all works out for the patient, it's no big deal. So you need to learn how to voice your opinion, but in a way that doesn't cause confrontation, or well, I guess we'll do it your way first. And you can do that by joking around, and I give specific examples, but I am recording this, and it'll probably take me about 30 seconds to think of something great. Well, wait, let's see. Nope. Nothing coming to mind. Although a common one would be muscle relaxants, whether to use a short-acting one like succinylcholine, or let's say a long-acting one like vecuronium that requires you to happily bag a patient. I don't like sucks because, or necting as it's called, you know, patients wiggling around, they're using up their precious oxygen stores to kind of shake around while they're being paralyzed. It's not a stylish way to go, really. But if someone wants to use it, it's once in a while you'll get a patient with sore muscles afterwards or whatnot, but it's not really a deal breaker. Who really cares? So in that situation, I'll throw out both, hand them the one I like. If they hand it back and pick the one they like, whatever, go with it. That works a lot better than just kind of doing the one you want and then having a discussion on which one you should use after you've already given the paralytic of your choice. That's kind of sneaky, kind of awkward. Yeah, I won't really recommend that. You don't want the reputation of someone who's lazy. I believe in the book I described it as being lazy is only one tiny step above the person who's kicking babies in the parking lot. You know, it's just not a good reputation at all. You certainly don't want to be the know-it-all or the poser. I don't think the kids these days use the word poser as much as I did when I was a boy, many, many years ago. Maybe half a decade, I don't know. Anyways, a poser being someone who talks the talk, pretends to be an awesome clinician, but when they really get in a situation, yeah, there's really not much there. I remember there was one specific incident of a male nurse that I worked with when I was a cardiac nurse, and he'd say all the macho nurse lingo. You know, there's only two types of male nurses, the macho male nurses and the more effeminate, caring male nurses. Maybe there's three, because I don't really fit into either of those. Anyways, so this guy would throw on some O2. Let's pump them full of nitro. Use great phrases like that to make sure that nursing appears to be a manly profession. Dude. So, one day a patient coded, the usual, and he starts doing CPR in a chair. Now, when you're resting in a chair, kind of relaxing, and somebody's trying to pump on your chest, it really doesn't have the same physics working for you that you would if that person was horizontal and you're standing over them comfortably, breaking a few ribs and depressing their sternum. So at that moment we're all like, he's a poser. All this time we thought he knew what he was talking about. But he's dumb and doesn't have good ideas. So you really don't want to be a poser. Another type of person that you don't want to be is a confrontational one. But I already discussed that. You'll see that in every ICU where there's that nurse. That no matter what the situation is, the drama level gets raised 2 or 3 notches above what it really should be. And they're really only comfortable working if there was some terrible drama in the situation. And you'll see that from place to place, and you'll soon realize that it doesn't matter what the situation is, they'll create drama. Whether it's something unimportant like, oh no, the epinephrine should have been at 2 mics a minute, and it was at 2.02 mics a minute. We should probably report somebody for this. Obviously the patient will suffer great harm because of this terrible mistake. You understand. Or if it's something more important. And really, being dramatic and starting to blame people, even for an important mistake, often shields the situation from really coming up with ideas that would fix it. You know, rather than saying, well, what can we do so that this doesn't happen again? Instead you're saying, well, obviously the fault is this or that. And the important thing is just to make sure that mistakes aren't repeated, not necessarily making sure that everyone realizes who the stupid one was in the situation. Man, my camera just ran out of memory. It's just starting to get good too. Now, I believe I was talking about the cost of your anesthesia education. Obviously you can get loans. I never did. I don't really believe in such a complex financial contraption. But for those of you who are normal, you'll probably be getting loans to fund your graduate degree. And really, you do have to dig a little deeper into a school to find out how much your education will really cost. For example, there are several prestigious institutions that are usually pretty expensive, but when it comes to the anesthesia part of their programs, there's all sorts of stipends and scholarships and grants and things of that nature that can actually make the education much more affordable than you'd think. On the other hand, there are many public schools that have relatively cheap tuitions, but they might add another cost for your clinical fees of several thousand a semester, and you know, it's kind of difficult to swallow when you think, well, here I am giving free care, but also paying an additional fee for the privilege of giving free care. Not that you should be paid as an anesthesia student, but I think you understand. So you may ask, why does the cost matter? Well, let's take nursing school for an example. This is a great example, actually. Your nursing education will be pretty similar wherever you go. Everyone takes the NCLEX, whether you are a diploma graduate, ADN graduate, or BSN graduate. You're still going to take the same test. Everyone has the same exact criteria that they have to meet by the governing bodies. They have to cover the exact same topics. They have to devote certain clinical times to this specialty or that specialty. So you are getting a similar education. Now, obviously there are some differences depending on how good your professors are, how good your clinical preceptors are, but I don't think there is any example from the worst nursing program in America to the best nursing program in America where that difference is worth, let's say, 40 grand. It just isn't. That's all there is to it. No one in healthcare looks at your resume and says, well, because you went to this school, we're not really going to take anything else into consideration. We'll just hire you because I'm sure that you don't kill patients nearly as often as someone who graduated from this program will. It doesn't matter as much. Obviously, business school, yes, it does matter where you go. But in healthcare, it's not that big of a deal, really. Compared to the cost difference that you'll find between schools, the quality just doesn't match up with that difference. So, the last point I wanted to bring up was disruption. And that means disruption to your normal lifestyle. Are you going to be moving across the country to some place where you don't know anyone, trying to set up your own social network, not in a Facebook type of way, but a literal social network, trying to set up your own, place to live? Or is this just going to be the hospital down the street that has a nursing program, so you're just going to stay at home with mom and dad or whoever and go to school that way? You obviously want to minimize disruption as much as possible, while at the same time I don't think this is nearly as important as the other two factors. So one thing you have to realize is you sometimes have to balance that between what is the best program for me, what can I afford, and what will cause at least disruption to my life. And that's because you only will have a finite amount of time, and you really don't want to spend that time getting lost in a new city, not having any friends. Because as my older brother, it's only fair he's my older brother as an example, since I already used my younger brother for one. My older brother wasn't able to concentrate very well when he first went to graduate school. So he decided he would remove everything from his apartment so that he would only be focused on his schoolwork. However, he found a printer manual, and he read that manual to his computer printer backwards and forwards, just because it was something that he could do to procrastinate. So sometimes thinking if I'm all alone, I'll get so much more work done, really doesn't work. The hermit lifestyle doesn't really lend itself to stellar scholastic, academic, and clinical performance. I'm sure there's something else I could talk about. So I talked earlier about not being lazy. One way you can do that is to make sure you're always on time for something. For me as a person, I'm often late. And it's simply because I'm selfish and I don't care enough about other people's time to consider them and be on time for them. That's all there is to it, if I were to be perfectly honest. And I am. I know what the issue is. But as a student, because again, you want to avoid any appearance of being lazy, even if you have to walk purposefully along the hallways pretending to be doing something, but don't overdo that, because I did that as a nurse tech, and then I noticed I overheard a staff member saying, "Ooh, let's see how many laps he does this time." And I realized, okay, this isn't as subtle as I thought it was, is it now? So, to avoid any pretense of not being motivated, of not caring about learning, because if you care about learning, people will go out of their way to teach you things. And really that's an issue too, to go on a tangent for a minute, that's an issue too with how do you select the clinical preceptors to try new skills with, and which ones do you realize quickly, I need to just do the basics that I know how to do well so that I don't get some horrible evaluation. That's the word I was looking for. So I don't get a horrible evaluation at the end of the day. And that can be tough because it's hard to gauge healthcare providers. They're used to dealing with annoying, obnoxious patients every day and smiling at them and saying, "Oh, that's not a problem at all. You're fine, sweetheart." When they're really thinking, "I don't like you. You're annoying. You're rude. You need to get better and get out of here." See? So it can be difficult to gauge those personalities. So it sometimes helps to get an evaluation from someone, to spend a day with them, and then you can say, "Hey, do you mind if I try a remifentanil Precedex drip? Or do you mind if we use ketamine along with propofol for this case? Or if I use a Miller 3 blade instead of the Mac 4 that I'm so comfortable with?" And obviously I'm giving anesthesia examples, but the same thing goes with learning assessment skills as a nurse or trying to figure out different equipment. That you really need to know, when do I just hone in on the basics, what I'm very good at, and when do I have the opportunity to try to expand my knowledge. This does work with the philosophy of a program. Obviously a cutthroat one where you think, if I make a mistake, they're going to kick me out of the program. Then you're a little bit less inclined to learn new skills. You'll suffer for it, but at the same time, needing to graduate is obviously a more important step than, learning how to do a lateral approach for a spinal or whatever. Yeah, that's all I got. I've been videotaping from the hotel bed. I put a pot upside down on that bed to have a level surface for that camera. That pot obviously being what I've been using to cook with that camping stove. Next time, my wife says that we should get a hotel that has a kitchen. That way I won't be starting fires indoors. That's a preposterous idea. Yeah, I'm just kidding. She's right. I'm wrong.